Below are 75 MCQs covering the listed nervous system topics, each with answer plus one-sentence explanation. Questions are grouped for clarity. MCQs, the nervous system, 75 total. Section A, neuron structure. 1. The basic functional unit of the nervous system is the A, axon, B, neuron, C, synapse, D, dendrite. Answer B, neurons transmit electrical and chemical signals throughout the body. 2. The part of the neuron that receives incoming signals is the A, axon, B, soma, C, dendrite, D, myelin sheath. Answer C, dendrites are branching structures specialized for receiving stimuli. 3. Myelin sheaths increase the speed of nerve conduction by A, blocking neurotransmitters, B, preventing depolarization, C, allowing saltatory conduction, D, thickening the axon. Answer C, myelination enables impulses to jump between nodes of Ranvier. 4. The axon terminal contains A, Nissl bodies, B, synaptic vesicles, C, D, nodes of Ranvier. Answer B, synaptic vesicles store neurotransmitters for release. 5. Which glial cell forms myelin in the CNS? A, Schwann cell, B, oligodendrocyte, C, astrocyte, D, ependymal cell. Answer B, oligodendrocytes myelinate multiple CNS axons. 6. Schwann cells myelinate neurons in the A, brain, B, spinal cord, C, PNS, D, autonomic ganglia only. Answer C, Schwann cells provide myelin to peripheral nerves. 7. The gap between two neurons is the A, synaptic cleft, B, node of Ranvier, C, axon hillock, D, central canal. Answer A, the synaptic cleft is where neurotransmitters cross between neurons. 8. Action potentials are generated at the A, axon hillock, B, dendrites, C, synaptic knob, D, soma. Answer: the axon hillock has a high density of voltage-gated channels. Neurotransmitters are released in response to A, sodium influx, B, calcium influx, C, potassium efflux, D, ATP release. Answer B, calcium entry triggers vesicle fusion and neurotransmitter release. 10. Nodes of Ranvier are important because they A, store neurotransmitters, B, prevent action potentials, C, allow rapid conduction, D, create new neurons. Answer C, nodes enable saltatory conduction. Section B, CNS, PNS 11 and 20. 11. Which system includes the brain and spinal cord? A, PNS, BNS, C, CNS, D, SNS. Answer C, the CNS is composed of the brain and spinal cord. 12. The PNS consists mainly of A, brain lobes, B, cranial and spinal nerves, C, cerebral cortex, D, meninges. Answer B, peripheral nerves carry signals to from the CNS. 13. The autonomic nervous system regulates A, voluntary muscle movement, B, sensory perception, C, involuntary activities, D, reflex arcs only. Answer C, ANS controls organ function, smooth muscle, and glands. 14. The sympathetic nervous system is responsible for A, resting digestion, B, fight or flight response, C, sleep regulation, D, memory formation. Answer B, sympathetic activation prepares the body for emergencies. 15. The parasympathetic division promotes A, pupil dilation, B, increased heart rate, C, rest and digest functions, D, sweating. Answer C, parasympathetic tone conserves energy and supports digestion. 16. The somatic nervous system controls A, smooth muscle, B, cardiac muscle, C, skeletal muscle, D, glands. Answer C, somatic pathways regulate voluntary skeletal contraction. 17. ANS motor pathways use A, 1 neuron, B, 2 neurons, C, 3 neurons, D, no neurons. Answer B, ANS uses preganglionic and postganglionic fibers. 18. Sympathetic ganglia are located A, near target organs, B, in the spinal cord, C, in paravertebral chains, D, in the cerebral cortex. Answer C, sympathetic chains run alongside the spine. 19. Parasympathetic fibers originate from thoracolumbar region, B, brainstem and sacral regions, C, entire spinal cord, D, cerebellum. Answer B, parasympathetic outflow is craniosacral. 20. Sensory neurons carry impulses, A, from CNS to muscles, B, from muscles to CNS, C, between interneurons, D, between ganglia. Answer B, sensory afferent neurons transmit signals to the CNS. Section C, brain structure and function 21 to 40. 21. The largest part of the brain is the A, brainstem, B, cerebrum, C, cerebellum, D, diencephalon. Answer B, the cerebrum accounts for most brain volume. 22. The frontal lobe primarily controls A, vision, B, hearing, C, motor function and decision making, D, balance. Answer C, the frontal cortex governs executive functions and movement. 23. The occipital lobe is responsible for A, speech, B, vision, C, memory, D, touch. Answer B, the occipital cortex processes visual information. 24. The temporal lobe is key for A, movement, B, smell, C, hearing and memory, D, vision. Answer C, temporal lobes contain auditory and memory centers. 25. The parietal lobe handles A, emotions, B, sensory information, C, language processing, D, hormone regulation. Answer B. Somatosensory cortex resides in the parietal region. 26. The cerebellum is vital for A. Memory, B. Conscious thought, C. Coordination and balance. Answer C. Cerebellum refines motor activity. 27. The brainstem includes the A. Thalamus, B. Midbrain, pons, medulla, C. Basal nuclei, D. Corpus callosum. Answer B. These three structures form the brainstem. 28. The thalamus acts as A. Motor control center, B. Sensory relay station, C. Hormone regulator, D. Memory center. Answer B. The thalamus processes and relays sensory input. 29. The hypothalamus regulates A. Balance, B. Emotion, C. Homeostasis and endocrine functions, D. Movement. Answer C. It controls temperature, thirst, hunger, and hormones. 30. Broca's area controls A. Speech production, B. Speech comprehension, C. Hearing, D. Vision. Answer A. Broca's area enables articulation and motor speech. 31. Wernicke's area controls A. Motor speech, B. Speech comprehension, C. Taste, D. Balance. Answer B. Wernicke's area interprets language. 32. The limbic system governs A. Fine motor control, B. Emotional responses, C. Vision, D. Smell only. Answer B. Limbic structures mediate emotion and memory. 33. The primary motor cortex is located in the A. Frontal lobe, B. Parietal lobe, C. Occipital lobe, D. Temporal lobe. Answer A. It sits on the precentral gyrus. 34. The primary sensory cortex is located in the A. Frontal lobe, B. Parietal lobe, C. Temporal lobe, D. Cerebellum. Answer B. It lies on the postcentral gyrus. 35. The corpus callosum connects A. Brain to spinal cord, B. Two cerebral hemispheres, C. Cerebellum to brainstem, D. Thalamus to cortex. Answer B. It is the major commissural fiber tract. 36. Damage to the medulla may impair A. Memory, B. Vision, C. Breathing and heart rate, D. Balance. Answer C. The medulla regulates vital autonomic functions. 37. The meninges include A. 2 layers, B. 3 layers, C. 4 layers, D. 5 layers. Answer B. Dura arachnoid and pia mater protect the CNS. 38. The midbrain controls A. Swallowing, B. Vision and auditory reflexes, C. Speech, D. Smell. Answer B. The midbrain houses reflex centers for eyes and ears. 39. The pons is involved in A. Digestion, B. Respiration and relay, C. Vision, D. Memory. Answer B. The pons coordinates breathing and signal transmission. 40. The hippocampus is essential for A. Motor learning, B. Autonomic control, C. Memory formation, D. Temperature regulation. Answer C. It converts short-term into long-term memory. Spinal cord and nerves, 4155. 41. The spinal cord ends at approximately AC7, B. T6, C. L1, L2, D. S1. Answer C. The conus medullaris terminates around L1, L2. 42. The cauda equina consists of A. Spinal roots, B. Neurons, C. Blood vessels, D. Meninges. Answer A. It is a bundle of spinal nerve roots. 43. Gray matter in the spinal cord contains A. Axons, B. Myelin, C. Neuronal cell bodies, D. CSF. Answer C. The butterfly-shaped center is rich in cell bodies. 44. White matter consists of A. Cell bodies, B. Myelinated axons, C. CSF, D. Neurotransmitters. Answer B. White matter is mainly axonal tracts. 45. Spinal nerves are A. Sensory only, B. Motor only, C. Mixed, D. Inhibitory only. Answer C. They contain both sensory and motor fibers. 46. Cranial nerve 2 is the A. Facial nerve, B. Optic nerve, C. Trigeminal nerve, D. Vestibulocochlear nerve. And B. CN2 transmits visual information. 47. Cranial nerve X is the A. Trochlear, B. Accessory, C. Hypoglossal, D. Vagus. And D. The vagus controls parasympathetic output to organs. 48. The largest cranial nerve is A. CNIB, CNV, CN7, D. CN12. Answer B. Trigeminal nerve is the largest and handles facial sensation. 49. Dermatomes represent areas supplied by A. Cranial nerves, B. Autonomic nerves, C. Spinal nerves, D. Ganglia. Answer C. Each dermatome corresponds to a specific spinal root. 50. The reflex arc does not require A. Brain involvement, B. Sensory neuron, C. Motor neuron, D. Effector. Answer A. Reflexes occur without conscious brain input. 51. The dorsal root contains A. Motor fibers, B. Sensory fibers, C. Mixed fibers, D. Parasympathetic fibers. Answer B. Sensory input enters via dorsal roots. 52. The ventral root contains A. Sensory fibers, B. Motor fibers, C. Autonomic only, D. Mixed. Answer B. Motor output exits through ventral roots. 53. The brachial plexus supplies the A. Legs, B. Arms, C. Abdomen, D. Face. Answer B. C5T1 roots innervate upper limbs. 54. The sciatic nerve arises from the A. Cervical plexus, B. Brachial plexus, C. Lumbar plexus, D. Sacral plexus. Answer D. The sacral plexus gives rise to the sciatic nerve. The phrenic nerve controls A. Eye movement, B. Breathing, C. Digestion, D. Swallowing. Answer B. The phrenic nerve stimulates the diaphragm. Schneider section E. Ventricular system, CSF formation, and circulation, 56. CSF is produced primarily by the A. Pituitary gland, B. Choroid plexus, C. Hypothalamus, D. Cerebellum, B. Choroid plexus within ventricles secretes CSF. 57. Which ventricle is midline and surrounded by the thalamus? A. Lateral, B. Third, C. Fourth, D. Central. Answer B. The third ventricle lies between thalamic halves. 58. CSF flows from lateral ventricles to the third ventricle via A. Foramen of Luschka, B. Cerebral aqueduct, C. Interventricular foramina, D. Foramen magnum. Answer C. Foramina of Monro connect these chambers. 59. The cerebral aqueduct connects the A. Lateral and third ventricles, B. Third and fourth ventricles, C. Fourth ventricle to spinal cord, D. Ventricles to meninges. Answer B. Aqueduct of Sylvius channels CSF downward. 6. CSF exits the fourth ventricle via A. Foramen magnum, B. Foramina of Luschka and Magendie, C. Optic canal, D. Central canal only. Answer B. These openings allow CSF into subarachnoid space. 61. CSF is absorbed by A. Choroid plexus, B. Meninges, C. Arachnoid villi, D. Cerebral cortex. Answer C. Arachnoid granulations drain CSF into venous sinuses. 62. A blockage in the cerebral aqueduct causes A. Hydrocephalus, B. Stroke, C. Meningitis, D. Epilepsy. Answer. CSF accumulation increases intracranial pressure. 63. The total volume of CSF in adults is about A. 20 milliliters, B. 50 milliliters, D. 500 milliliters. Answer C. Average adult CSF volume is around 150 milliliters. 64. CSF functions to A. Store electrolytes, B. Cushion the brain, C. Replace neurotransmitters, D. Supply oxygen. Answer B. It protects and nourishes neural tissue. 65. CSF circulates in the A. Epidural space, B. Subarachnoid space, C. Subdural space, D. Subpial space. Answer B. The subarachnoid space houses circulating CSF. Section F. Nursing application. 66. Signs of increased intracranial pressure include A. Bradycardia and hypertension, B. Tachycardia, C. Hypotension, D. Low respiration. Answer A. Cushing's triad reflects rising ICP. 67. A patient with a spinal cord injury at C4 is most at risk for A. Loss of arm movement only, B. Respiratory failure, C. Loss of bowel control only, D. Memory loss. Answer B. Injury above C5 compromises diaphragm function. 68. In stroke assessment, FAST stands for A. Face, arms, speech time, B. Feet, ankles, spine touch, C. Force, accuracy, speech tremor, D. None. Answer FAST helps identify stroke symptoms quickly. 69. Parasympathetic stimulation causes A. Increased heart rate, B. Pupil dilation, C. Increased GI motility, D. Bronchodilation. Answer C. Parasympathetic activation promotes digestion. 70. Sympathetic activation during stress causes A. Decreased cardiac output, B. Vasodilation in GI tract, C. Increased heart rate and BP, D. Sleepiness. Answer C. Fight or flight increases cardiovascular output. 71. A lumbar puncture is performed between A. C1-C2, B. T5, T6, L3, L4, or L4, L5, D. S1, S2, C. LP is done below spinal cord termination for safety. 72. Damage to Broca's area leads to A. Fluent but meaningless speech, B. Inability to produce speech, C. Inability to understand speech, D. Vision loss. Answer B. Broca's aphasia impairs speech production. 73. Patients with Parkinson's disease lack A. Serotonin, B. Dopamine, C. Acetylcholine, D. GABA. Answer B. Loss of dopamine in basal ganglia causes motor symptoms. 74. The Glasgow Coma Scale assesses A. Memory, B. Reflexes, C. Eye, verbal, and motor responses, D. Sensation. Answer C. GCS evaluates level of consciousness. 75. During a seizure, the nurse should A. Restrain the patient, B. Insert an oral airway, C. Protect the head and maintain safety, D. Give food. Answer C. Safety and airway protection are the primary concerns. Thank you. Have a nice day.